Before I approach the scene, I'll make sure that the scene is safe. I'll grab the curtains for privacy, quickly do my hand wash, and I'll respect the kitchen guidelines.
And side effects of this, you may not.
This assessor, half an hour before the procedure, it is ideal to close the windows, to shut the curtains, to cease all the housekeeping activities, and to switch off all the fans. I'm happy to approach my patient now, Miss Assessor.
Okay.
I would like to check my patient's identity, but please, Miss Assessor, can you confirm if all pre-checks are done?
Done.
Thank you. So does that mean my patient knows me? I know the patient. I have sought for the consent, and the patient is paying free.
Correct.
Thank you. I'm just going to quickly assess my patient's wound, Miss Assessor. I can see that my patient's wound has got redness around the surroundings. I think that this patient's wound has got erythema, but there is no exudate and I can't smell any foul odor. Miss Assessor, I'll be checking for my patient's pain and tenderness. Please confirm if my patient is in pain. Is my patient in pain? Yeah, my
Yes.
patient is in pain. Okay. I'll make sure, Miss Assessor, ideally before the dressing, I will need to give my patient some pain relief.
Okay.
May I proceed for the sake of this scenario?
Proceed.
Thank you, Miss Assessor. But my assessment would be referred to the clinician. I'll make sure that I make a comprehensive plan. I'll make sure that I ask my patient to drink lots of water. I'll make sure that I assess the wound and keep an eye. I will encourage my patient to clean her hands. Make sure the patient leaves the dressing clean and dry.
Correct.
I will refer this to the clinician. I may well swab this during the dressing or before the dressing. May I proceed, Miss Assessor?
Proceed.
Thank you. Okay. Is the tray or the trolley washed in the last 24 hours with soap and water?
Correct. Proceed.
Would you like me to wash it?
Yes, please wash it. Clean it.
Thank you.
Thank you.
The gloves are good to go, Miss Assessor.
Yes, intact and in
Nail
date.
wipe, thank you. In
Intact.
date, I'm happy to use.
Yes.
One hand, look. 1, 2, 3, 4. 1 to the right, 8, 4. Throw, get another one. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. I have here Kitan, it's in date. I'm happy to use. One, 2, 3, 4, 5. I have here dressing package in date, I'm happy to use. Sterile gloves, it's in date, I'm happy to use. Me4, it's in date, I'm happy to use. Vinyl wipe, it's in date, I'm happy to use. So, no precipitate, no cloudiness, I'm happy to use. Okay, I'm happy to approach my patient now, Miss Assessor.
Okay.
I'll make sure that I close the curtains for privacy. I will reconfirm my patient's identity and reaffirm my patient's consent. I'll ask my patient. To let me know if she or he is comfortable.
Okay.
this one you can close up like that.
Mm-hmm.
Because I will teach you how to open them. Okay. Right. Always this tongue, always towards you, the opening that way. Right. You guys can hold this because this is clean. The sterile one is that one. So you don't touch that white thing. Look. And
Yes, regarding.
okay, so this one, just touch this tip only.
Mm-hmm.
This one is the next one along and stretch it like this. Don't cross your arms over. You can turn it around like this. Make sure this is stretched, otherwise it will ping back. Look, don't let go, and then let go, don't let go, and stretch. This one, don't let go. This one, don't let go. There we go. Do not cross over.
Okay.
Now I'm going to, if you wanna, so all I need is one gauze, one sterile glove. Kita mana? Only one. Lift. If you are using, make sure this is closest to the patient. Your only concern is these gloves. The rest you can arrange later when you have the gloves. Make sure you have access to your gloves. And then the rest, make sure it's not touching at least 2 inches of the corners.
Okay.
Okay, I'll do the rest later on. This one closest to the patient. Look. Okay. Open. Don't clean on top of the sterile field. Make sure we are looking at this black thing. Okay, so clean this for 30 seconds. Mrs. Cesar, may I proceed?
Proceed.
Thank you. Air dry for 30 seconds.
Okay, proceed.
Only a tiny bit. Make sure you are only going to put, Mrs. Cesar, I will only use a small one.
Okay.
Throw. No. What goes down should go up. So my dressing, don't leave it too high. Just as low as possible, but not touching your sterile.
Go.
Okay, I am now ready. Avoid flipping the fingers. Okay, that's the sterile area now. This one, underneath, open, and lift. There we go. Okay, now don't proclaim this one as clean and sterile unless you have already separated your gauzes. Okay. And look, this shiny blue one is the one that goes on the skin. Don't flick it. Look at this, guys. Once you put it there, drop it. Okay? And then you can still move it because this is still sterile technically, but never touch the clothes. Second one. Open and drop. Okay, Miss Assessor, I can now declare that this is my sterile, this is my clean hand.
Okay.
Dip, squeeze, drop, one stroke, throw, dip, pick, drop, pat dry, throw, and look at this. That's okay. That's okay. This you can't touch behind what's on the other side of this because that's what's meant to touch the skin. So this is a flippy floppy thingy. That's what needs to go on the skin. Seal it. If you don't seal it, you'll still fail it even if you finish in time. And then follow it with your finger. All done. Throw everything in the clinical waste bin. Encourage your patient to eat lots of green leafy vegetables. Hygiene. Don't touch the wound. I just did that so